Your blood pressure is high, but what if I told you it doesn't always take medication to fix it? There are real, medically proven ways to lower it naturally, and some of them are easier than you think. One of the biggest drivers of high blood pressure is sodium or salt. You may be eating way more of it than you think. Most of the sodium in your diet doesn't come from the salt shaker. It's hidden in packaged foods like canned soups, frozen meals, salad dressings, and even breads. Restaurant foods are also commonly high in sodium. Too much sodium causes your body to hold on to water, which raises the pressure inside your arteries. This is what you can do. Start by reading food labels and look for options with under 300 milligrams of sodium per serving. Cook at home more often and flavor your meals with herbs, spices, vinegar, garlic, or lemon instead of salt. Try to keep your sodium intake below 2,300 milligrams per day. And if your blood pressure is already high, or if you have diabetes, high cholesterol, or a family history of early heart disease, then aim for under 1,500 milligrams per day. Even a modest reduction in sodium can lower your systolic blood pressure by 5 to 6 points. Potassium works in the opposite direction of sodium. It helps lower your blood pressure by helping your kidneys flush out sodium and by relaxing your blood vessels. Unfortunately, many people don't get enough potassium in their diet. Great sources of potassium include leafy greens like spinach and kale, avocados, beans, sweet potatoes, bananas, oranges, yogurt, and salmon. Aim for 3,500 to 4,700 milligrams per day from food. Some supplements have strong clinical evidence supporting their ability to lower blood pressure. If used wisely and safely, they can enhance the effects of diet and exercise. Magnesium helps relax arteries. A daily dose of 200 to 400 milligrams is typically recommended. Magnesium glycinate or magnesium citrate are preferred. Keep in mind that it can cause diarrhea in high doses and should be used cautiously in people with kidney disease or those on diuretics or blood pressure medications. Omega-3 fatty acids from fish oil reduce inflammation and help arteries relax. A dose of 1,000 to 2,000 milligrams per day is common. Just be aware that omega-3s can increase bleeding risk, especially with blood thinners like aspirin or warfarin, and may cause mild digestive upset. Coenzyme Q10 supports the heart's energy production and helps relax blood vessels. A dose of 100 to 200 milligrams per day taken with meals is ideal. CoQ10 may increase the effect of blood pressure meds and interact with warfarin. Beetroot is rich in nitrates, which your body converts into nitric oxide, a compound that widens blood vessels. A dose of 250 to 500 milliliters of beet juice or 500 to 1,000 milligrams of nitrate extract is common. Make sure to avoid this if you're taking erectile dysfunction meds, as it may cause the blood pressure to drop too low. It may also turn your urine or stool reddish, which is harmless. And also it's high in oxalate, so avoid it if you're prone to oxalate kidney stones. Aged garlic extract acts as a natural ACE inhibitor. ACE inhibitors are a common type of blood pressure medication. A daily dose of 600 to 1,200 milligrams of standardized extract is common. But watch out, garlic can increase bleeding risk and may amplify the effects of blood pressure medications. Hibiscus tea acts as a natural diuretic and ACE inhibitor. 1 to 2 cups per day may help, but it should be avoided during pregnancy. It may enhance diuretics and lower blood sugar, so use with caution with diabetes medications. Always talk to your doctor before starting any supplement, especially if you're on prescription medications or have chronic conditions. Start with one supplement at a time at a low dose and track your blood pressure. Exercise is one of the most effective ways to lower blood pressure naturally. Cardio activities like walking, biking, or swimming improve circulation and lower vascular resistance. Losing just 10 to 15 pounds can drop systolic blood pressure by 5 to 10 points. Strength training also helps by maintaining the flexibility of your arteries. Flexible arteries expand and contract more easily, keeping blood pressure stable and reducing your risk of heart disease and stroke. Aim for 150 minutes of moderate intensity aerobic activity per week, plus 2 to 3 days of strength training. Also try to include movement throughout the day, especially walking after meals. Small activity bursts really add up. Chronic stress keeps your body in a state of alert, triggering the release of hormones like cortisol and adrenaline, both of which raise blood pressure. Over time, this ongoing stress puts a serious strain on your heart and blood vessels. Reducing stress can improve your blood pressure, heart rate variability, and vascular health. You can do this with deep breathing exercises, walks in nature, spending time with family and friends, or listening to calming music. Avoid alcohol and smoking. Both alcohol and smoking raise blood pressure and can sabotage all your other healthy habits. Alcohol increases sympathetic nervous activity, which spikes your blood pressure. Drinking more than 1 drink a day for women or 2 for men increases your risk of hypertension. Smoking causes immediate narrowing of the arteries and raises heart rate. Over time, it stiffens arteries and promotes atherosclerosis. The good news is that quitting smoking can reduce blood pressure within weeks and lower cardiovascular risk within months. The DASH diet, short for Dietary Approaches to Stop Hypertension, is one of the most effective non-drug strategies available. It emphasizes 8 to 10 servings of fruits and vegetables a day, whole grains, lean proteins like chicken and fish, legumes, and low-fat dairy. It's low in sodium, saturated fat, and added sugars, while rich in potassium, magnesium, and calcium. Studies show the DASH diet can lower systolic blood pressure by up to 11 points in just a few weeks. You can simply start by swapping 1 processed meal a day for a DASH-style plate. Measure your blood pressure at home is essential. It helps you and your doctor see how well your changes are working. Use a validated digital cuff and sit quietly for 5 minutes before measuring. Check it twice a day, once in the morning, once in the evening. Record your results and look for trends, not isolated spikes. So that's how you can start lowering your blood pressure naturally. Reduce sodium, get more potassium, stay active, lose excess weight, manage stress, limit alcohol, quit smoking, use evidence-based supplements, follow the DASH diet, and monitor your blood pressure regularly. You don't need to do everything at once, but the sooner you start, the better your heart will thank you. If this video helped you, hit the like button and subscribe for more doctor-backed health information. Let me know in the comments what's the first change you're making today. This is not medical advice. Thanks for watching, take care, and I'll see you in the next video.